wrote a whole piece about how we are still approaching the pandemic on an individual level
Mhm,
and sort of
mhm.
shaming individuals to get vaccinated, which like I'm on board for, but there is so much more
Yeah.
on a federal level that can be done. Biden's even said this is not a federal thing. There's no federal solution. He literally
Mhm,
said those words.
mhm. Yeah.
What's your response to something like that?
So I think what I always like to preface the conversation is like there is medicine and then there's public health, right? Medicine is you treat the individual, you take a drug, whatever. You're only talking about your own personal health. Then there's public health, which is like a population level metric, right? You have to, and in that sense, you literally cannot individualize yourself out of a pandemic. You can't treat it like one by one by one by one, and I mean that both in the in our sense where we have a country of partially vaccinated people and but also globally, right? You can have a high vaccinated country and you can have countries that aren't vaccinated and it doesn't really matter. And so I mean, not that it doesn't matter, the pandemic doesn't end. So essentially what you have to do is you have to control the spread of the disease, whatever way that is. So there's vaccines, but then there's obviously masking, there's a lot of testing involved. There's ventilation is really important, like upgrading the air cleaning the air that we live in.
Mhm.
And of course there's distancing and all the like. So until I think predominantly how we talk about in the last couple of months, how we talk about the pandemic is it saves you from going to the hospital or it saves you from dying. So in a very
The
individual term.
vaccine, right?
Yes, yes.
Just yeah. Mhm.
So the problem with that is like if you're in a high vaccinated area and you're a vulnerable person, so let's say you're an under five child, or let's say you are who have lower risk, but we'll get into that. Somewhat lower risk. We'll get into that in a second.
My dad has 0 antibodies because he went through
Right.
chemo earlier in the pandemic, so he's
Yeah,
like
immunocompromised people,
yeah.
people who are who have a disability or who are, like you said, like your dad who went through certain treatments. And so when you're in an environment of high spread, which unfortunately due to Omicron, like I don't know how to pronounce it, due to the new variant, is much of the country. These people then are now put at risk, right? And that's where vaccination kind of helped. Is that you had lots of people kind of the collective protection that is offered by vaccines reduces the spread and then protects these vulnerable people. And so when we talk about, for example, under 5 children, right? People are like, oh well, kids aren't high risk, but if you take a fraction, right? If you take a fraction and you increase the number on the bottom, right? And the more you increase, let's say you have like 20%, right? Like or like I don't know, let's say the number is 10%. It's not that
Mhm.
high, but let's say you
Mhm.
have a 10% number, and you increase the number at the bottom. The number at the top also goes up. So that's why you're seeing a lot of children ending up in the hospital because a lot of children are getting infected. The amount of percentage of children who will have severe outcomes is very low, but because you have uncontrolled spread, um, you end up
Yeah.
having these issues with the hospital. So that's just the reason why you can't individualize yourself in a pandemic. What we would want from the Biden administration, and there's complete consensus in the field of public health in terms of people I talk to, in terms of the rank and file, is just an acknowledgement that the pandemic is going on beyond like get vaccinated, get boosters. There has been a complete resistance to go back to that sort of collective level. Just talking about messaging, even we can get
Mm.
into all the stuff they can do, but there's a palpable amount of anger that the administration is not taking the pandemic seriously.
Even from his own ranks, I just want to say this week, I believe, people who were his former health advisors actually spoke out and said, look, we need to treat the pandemic as something that's here to stay. And what are we going to do with that knowledge? That's something that we cannot completely eradicate. That doesn't mean to say, you're going to get sick, whatever, blah. And it definitely doesn't mean, go back to work after 5 days. It means like, what are the other mitigating factors? What are the other things we can do to help people knowing how rapid the spread is, knowing how this will and could continue. Sad to say, it sucks. I wish there was a light at the end of the tunnel, but we don't deserve it, do we? We don't really deserve it as Americans. I do want to say though, Biden has said he's doubling the COVID-19 testing kits. They're apparently going to be online and available in like 3 days. We'll see. That N95 masks are going to be distributed to the public. He's deploying 1,000 military medics to hospitals around the country. What about the National Defense Production Act? How does public health work into that?
So
At all?
those are important components, right? The National Defense Production Act should be used to improve up the production of masks and tests and all the like. But what we're missing is like a coordinated strategy here from the federal government in terms of piecing these things all together. These things all happen in reaction, right? Oh, we need to send, people are like, we need masks, we need to send free. So they're like, okay, we'll send free masks. But well, we're only going to send a couple masks. And then, oh, free tests, we're going to send you 4 tests, right? And so which 4 tests per household is like, that's not that much. And so,
by the way, not to brag, we did go to a super spreader and we sent away for the test and we only got 1 and we got it a million years after we probably already were over having COVID. So it doesn't even really pan out that well, even when they do promise it.
You said you went to a super spreader, like it was like no big deal. It was like a VIP event. Like you went to a super spreader.
It was VIP super spreader.
It was. And then we couldn't get a test and everyone else had it.
Somehow.
And then we couldn't get our hands on a test. And we did the thing where they said they'd send it to you. And they said we thought we would get at least 2.
But we got 1 and it came.
So then I was like, just throw it away. Just kidding. We have to. But we haven't taken it now. We don't know. We're
I peed on it and I'm pregnant.
Right. So it's like 4 tests are still not even enough.
Yeah, and it's all in reaction, right? It feels like for me, it feels like the Biden administration is chasing a past that is not there anymore. And they're chasing the sort of summer period in which, vaccines were more protective, but we still had a bunch of people dying. And so what I would like to see is a complete acknowledgement and a reset almost, right? That we have to almost we have to live with the pandemic, as people are saying, or live with the virus, as people are saying. And what does that mean? How do we give people the tools to protect themselves? How do we give people the tools to people who have to work in person? Like, what should they do to protect themselves at work? How can we assist them, like issuing that temporary standard guidance? And public health in America is underfunded and it's near collapse because we don't have the amount of people, like the departments, right now, because of the spread is so high, there's only so much they can do, and there's only so much they can do and say, and they feel undercut by an administration that doesn't really know its own messaging around the pandemic. And one thing that I would like to see real quickly is just go back to what you promised in your campaign plan as a start. Like the president promised 100,000 public health workers, which we would love, right? We would love. Which we would need to really get these things out to people and reach every person in the country, or as many people in the country as possible. That's one start. There's just really not an acknowledgement that this is a gargantuan, traumatic event on the level of the Great Depression, the Civil War. It's just let's just get this over with and go through. So it's just lack of strategy. And so there's so many things the Biden administration should do. Let's start with an acknowledgement that what we're doing right now isn't.
Yeah, rather than we have to get back to normal. Let's keep society running, as Dr. Fauci has been saying, which is really actually depressing as shit, to be honest with you. Yeah. But what, in terms of public health and preparedness, you're saying, mobilize, you should have mobilized a year ago when you said it, training programs or whatnot to get those 100,000 public healthcare workers go. But what are the barriers to that, right? Just paint a picture of the future coming out of this. Are we at the behest of the private insurance industry? Is that what's holding us back? Is it big pharma that's holding us back? Or is it just the sheer reliance on those two entities from the federal government and from politicians rather than an investment in something like public health?
So there's a number of things. So the guy who's running the COVID-19 task force is Jeffrey Zients. He's a mega businessman. I've heard it described as he's if you were to get Stephen Miller to run immigration policy, essentially, it's very pro-business, very let it open sort of thing. It's not for a public health response, you would want a public health professional or someone, at least a doctor at least, who technically isn't public health, but you would want someone with public health experience at least leading it, right? But we have a businessman who is leading it. And so business has consistently directed the pandemic response. Prior to the CDC issuing the 5-day, messy guidance about isolation, Delta Airlines had sent a letter to the CDC being like, these isolation guidelines are really kicking our ass. Can you just change them? And then a few weeks later, lo and behold, they changed them, which according to some people that even blindsided people within the agency itself.
Oh shit.
So there is like a huge reliance on corporate influence. Corporate America is kind of driving.
Yeah.
And then another thing that I would say is that there's corporate America that's driving the response, and then another problem is like I'd say like there's just like a lack of the country is divided into 3 components essentially. There are people who are still taking this seriously. There are people who are not taking this seriously, and there are people who are in the middle. And I'd say the people in the middle are kind of like the majority, who could go either way essentially, based on what
Tuesdays I'm scared, Thursdays it's whatevs.
Based on what the prevailing attitude is, and so there is a lack of. I guess like it's been so long, and there's like a lack of cohesive pressure and stuff, and the lack of thing that kind of allows those in power to kind of take advantage and be like, well, let's hope this is the last surge and get through it, and then we won't have to prepare. But of course, more variants, could.
That's been the saddest thing to me, is to see this administration go like, well, who could have predicted a variant? And we were like, everyone. What's going on, Frantifa? If you haven't already, subscribe to this channel right now. Hit that button. And also, you can become a patron and support the show every single week. Get access to bonus episodes and exclusive merchandise. Patreon.com/Bitchuation Room. Do